we have also, this is going to be a second session, which is going to be a question and answer session. We will give you an opportunity to ask Kim questions. And I will read from some of the questions that people have also written down here. So I will start with Alan to ask. Maybe we have 2 questions, and then Kim can give us some answers. So 2 questions. I'll start with what we will have an opportunity to do that.
Thank you. My question to Kim is, I know you mentioned that your focus for today is not inclusive of healthcare at the moment. But as you know, we are focusing on healthcare. I know that in your operation and experience, you have applied models of different kinds, which we think that we can benefit from. So my question is there any basic model that you have? I know I've asked you this now, but just for the sake of the others, is there any model that you think you can apply which can inform us of any challenges that we might face, or any pointers that you can let us know about so that we can prepare ourselves? Thank you.
Thank you, Alan. I've got a similar question here. Kim. It says, what challenges are most common for people like us who are starting?
You know, for someone coming from the biotech and pharmaceutical industry, it's exceedingly frustrating for me not to find a model so far of how to provide healthcare at the lowest costs possible for people. We've tackled all kinds of other areas, including education and so on, but health has really just been very challenging to find a model that's sustainable. But let me, you know, if we're looking just as a straight business opportunity for Uganda, then I would say at the high end there's a need for some really good hospitals. But that's not my area of interest. I built a specialist cancer hospital in Malaysia as a center of excellence all those years ago, and I know how to do that, but it's not for me. It's not for me to sort of do that in Africa. It's for somebody else. So there's a need for high-end specialists, Aga Khan type hospitals in Uganda as an opportunity. I think there's an opportunity for diagnostics. So we have a shortage of CT scans, MRI scanners, maybe even X-rays. And I can see centers that sort of provide that service. I think there's a need for that. But at the lower end, how do we provide healthcare for the poor? So here's a model that I was really very interested to pilot, and we spoke to a doctor in Kampala, I think for about 8-9 months, but unfortunately we persuaded him to do it. So here's the model. The problem that we have with the poor in terms of healthcare are several. For one, it costs money and time for the poor to get to a clinic, right? It's time and money. Sometimes those, and then when they come to the clinic, they're not seen to efficiently, so that costs them even more time and money, right? It's very inefficient. But then furthermore, they are, if they're in some poor setting, they don't have any real diagnostics because it costs money as well. And secondly, without the diagnostics, they get poor treatment. If they just go to the local pharmacy, it's even worse because there is no diagnostics. They will get counterfeit medicine, or they might get the medicine prescribed to them that is not relevant, but it makes the most money for the pharmacist, right? So we got all those kinds of challenges for us with the poor. But one of the things that I observe is pharmacies are ubiquitous all over the place. Everywhere we go in the slums, you see pharmacies. They're everywhere. Which says a few things to me. It says that there's a market. Secondly, they are accessible for the poor. They're accessible for the poor. So my question that started last year, is there a way we could have a kind of cottage hospital near to a slum? We have a chain of pharmacies that we own, branded, for a number of reasons. And into those pharmacies, we don't just have pharmacists, we put a nurse that will provide some basic diagnostics, rapid diagnostics. Because we can do malaria on the spot, right? There are now, these kind of what we call lateral flow tests, a bit like the pregnancy test, where with just one finger prick of blood, we can do a whole bunch of diagnostics. Okay? So is that, an X-ray machine, a portable X-ray machine is not expensive. A portable ultrasound scanner is not expensive. So you can have that run by a nurse in a pharmacy, right? But that's linked to, that's like a spoke into a hub, which is the central hospital, yeah, the cottage hospital. And the data, the test results are then, through whatever communication mode we want, sent to the hospital. There's a clinician at the hospital who looks at the test results and makes the diagnostic. Right? So the poor then don't have to get to the hospital. Right? Stays at the pharmacy level. And if the result is, hey, you know what, all you have is your diarrhea, you don't need to take any drugs. You don't have to buy any drugs. Just go home, drink some water, throw some salt, throw some sugar in, and you'll be fine in a few days. That's the kind of diagnosis we should give to the poor. But you can only do that when you own the pharmacy. Because if you don't, the pharmacist will want to sell you some drugs, right? So in order to practice good medicine, we need to own the whole chain. We have to have the whole value chain. So at the pharmacy end, at that end, we need honest medicine. We sell genuine drugs relevant to that condition. And we sell it at the best price. We sell it generic rather than one that will give us the best margin at that end. And the other end, the doctors who look at the results have also got to have that honesty and say, actually, you don't need to come. You don't need to come, and you don't need an X-ray. You don't need this, you don't need that, right? Or, if it's really serious, hey, get on a border and come to the hospital because you probably need a surgical procedure, whatever. Or you've got malaria and you need to come in. If you then have a spoke and hub, and let's say you own 10 pharmacies from that hospital. What you then have is you have several things. One, you have economy of scale. You can then buy drugs in bulk. And you can reduce the price for the poor. Because currently all these small little pharmacies are buying it at retail prices. Right? But if you have a chain, and this is why supermarket chains and all these big chains, they have the power, the purchasing power. So if you had a chain of pharmacies like that, your consumables will be cheaper, your drugs will be cheaper, everything will be cheaper, and then you can then reduce your costs for the poor. And more critically, you provide better quality medicine, better quality healthcare, and you save the poor the time and the money to come all that way to the hospital. And when they come to the hospital, we need to treat them efficiently, and if they need surgery, and it's done quickly, as cheaply as we can. So that was the model, and there was this cottage hospital, but I couldn't persuade them to engage with the poor. It was really serving the middle income and upper middle income. I would love to find a doctor with a surgery that can be expanded. We can put some, and it's just, we're talking day surgery here. Do some day surgery stuff. And then later on, if you want to put an operating room in for sort of general surgery, you can do that too. It's not that expensive. And I invested in a generic drugs company in India. We manufactured 200 drugs. So we know about generic drugs. We know about good quality and bad quality generic drugs. So we have access to that. We're involved in investing in new rapid diagnostic tests that takes 1 minute, 2 minutes, and we can tell what's happening with your diabetes, your steroids, your thyroids, your endocrine system, etc., etc. These are available now. These are available, but it needs some serious investment. But it needs good people. It needs good, honest people. So that's my vision. That's my dream, to try and pilot something like that. Something like that. I haven't worked it out. We were going to invest in this hospital, provided we were willing to, bring this pharmacy chain into being. But the power you have, your purchasing power, is very strong, very, very strong. But you can't partner, or you can, but the guy has to be honest. Most pharmacies just want to sell drugs, right? So this is why you've got to have some control over that. Now I learned that when we were building, when I was running our cancer hospital in Malaysia. You see, when people are poor, they're easy to exploit. When they are poor and sick, they're even easier to exploit. And that's the tragedy. And so in the private hospital, cancer hospital in Malaysia, the way it's run, when people come and they have cancer, you want to try everything under the sun, even when it's hopeless. Because if you don't treat, you can't charge them. So one of the things we did with the hospital in Malaysia was I changed the model. Instead of doctors practicing on their own, they were employed. They were employed by the hospital. They were paid a fixed salary. So whether they tell the patients to go home, there's no more we can do, we don't waste any more money, or whether they say this is a treatment you should consider, it makes no difference. You take the financial responsibility away from them. They are only interested in the best clinical care for the patients. So we need to take that financial incentive away from the pharmacists, away from the hospitals, if we want them to be able to practice good medicine. So those are some of the challenges, because unfortunately medicine has moved from being a profession to a trade. It's become a trade. It's about making money now, sadly. Sadly. right? But we need to pilot some a healthcare model that can make it. It can't be free because drugs cost money and equipment costs money, but it needs to be at the lowest price point possible. And the fact of the matter is that many of our people in our slums can't afford medicine. They will go to the pharmacists to buy drugs. It's just that they're buying lousy drugs or even fake drugs. Right? So the spending, the power to spend is already there. We need to help them to maximize what they're spending on better healthcare and better medicine. Any thoughts? Anybody?
Yes, thank you very much. I was thinking like due to, to invest in such a thing, you must be using that funds. So I was thinking if you have the hospital cottage, but then you don't have enough funds to expand into these community clinics. So does it make any sense if you have a hospital cottage and then you can have a mobile clinic, which is in the hospital, the basics, connect with that is, so that can going to the slums and take the test from there and leave the patients at home. So you bring all the tests and the hospital cottage, carry out the results, then you contact back to the patients. So if the patient will come to the hospital, so they can come to see their treatment. So thereafter, when you gain your grounds, then you can expand and make this
Yeah, this kind of mobile kind of system hasn't worked very well, and I tell you why. I think it's basically because if you don't treat and don't diagnose immediately, you lose the patients. And that's been our problem with HIV/AIDS. Patients spend money and time to come to a clinic. They take blood, but they don't get their CD4 counts until whenever, because the blood gets sent off to a center. Patients go home, and you've lost them. It's very difficult for them to have 2 visits. It needs to be in one visit. You've got to be able to do the diagnostic and the treatment and decisions made. Otherwise, you lose.
Thank you very much. First of all, I would like to thank the organizers of this occasion. I am really, really pleased to be here. For me, what I would like to ask or make an observation is that when you talk about most of these things, sometimes we tend to have ideas, and as between us, we tend to kind of brainstorm between ourselves. And as a person, first of all, in my field right now, studying to be a solicitor, I have access to the physical and mental infrastructure of my senior partners. What I find with our societies usually, most especially with Ugandans or black and ethnic minorities, is we tend to lack mentors. And I would like to be like kind of Oliver Twist and ask you that we want more. Like we want maybe some of your expertise or your mentorship, and maybe through Isaiah or one of our leaders, through Alan, somebody that can contact you when we have an idea. For instance, what you have spoken about, we had something similar, and it was whether we can use barcoding technology. So when you sell medicine, or whether a patient comes in, you give them a number, you give your medicine, similar to that you can monitor it remotely, wherever you are, whichever hospital they are in. So they know that when they come to your satellite clinics, they have a certain number or they have a certain code that a doctor or a practitioner can monitor that remotely. But what we need is somebody of your expertise that, not to bother you, but just to when we have those moments that we can maybe come together and say we should email doctor and see what maybe he might think, or if he can give us an idea. So just to ask, I know it's a bit asking too much, but we just need your mentorship. Thank you.
I would say, Paul, plug into the transformation business network. The TVN network is a very open network. Anyone can participate, can throw questions into the network, and hopefully a member within the network will have the expertise to comment. And then furthermore, we've got funds and we've got offices on the ground, not in Uganda, but in Nairobi, or near us. And in Nairobi, we are looking to invest in 2-3 small chains of 6 clinics. One of them has 4 clinics. So we're starting to sort of put a toe in the water, put some investments in these small chains to see if they will work. Right? And they've been around for a few years. They've gone through a lot of pain. Things have worked, some haven't worked. They've learned a lot. We're now at a stage where I think we'll put some money to work in a number of these chains. So we're in learning in this healthcare space as well. So we may not have the answer. We may not know how to answer your questions, because we are also at a stage where we are trying to see which model will work sustainably. I can really benefit the poor.
Thank you.